Hi, I'm Carlisle Hashem, and this is the Carlisle Hashem Show. And today we are here at Towson University to talk about Philip Seymour Hoffman, not as the great actor that he was, but as a gentleman who unfortunately died of heroin. And with me are our guest, Paul Pistel, who is a behavioral neuroscientist here at Towson, a doctor, and Elizabeth Katz, a doctor also of clinical psychology. We'll start off with you, Elizabeth, or I can call you Liz.
Liz would be great.
Could you tell us how Hoffman's death affected you?
Well, it's devastating, and unfortunately I think that because of the fact that he was a celebrity, it brought a tremendous amount of attention, but I think what it really raises for me is the fact that what a tragedy that people are using drugs and that they use it to the extent that it takes their lives. And it's not just him. I mean, there's a large number of people in the United States, both his age and younger, who are suffering from heroin addiction and who are paying the consequences of it.
And Paul, you were talking earlier about the heroin and its effects on the body. Could you explain that, please?
Well, I mean, essentially from an addiction standpoint, it's producing a rapid euphoria. Very quickly, most people are injecting it, and it's getting to your vein very rapidly. And it's also getting out of the system fairly rapidly and producing withdrawal symptoms during that time period. And so often what you see is people using the drug to produce that euphoria over and over again. And then eventually they don't have access to the drug right away, or they're trying to stop using it and they go through those withdrawal symptoms, right, that the body's producing, and that drives their desire to either experience the euphoria again, or in many cases with heroin it seems to be the case that they're trying to relieve the withdrawal symptoms, the aversive withdrawal symptoms. And so the biological changes that are going on, again, we're starting to understand that, but we know that there's a genetic changes, there's changes at the neuronal level, at the chemical level, that are all occurring during this process.
And Liz, how does, we'll say with Hoffman at age 46, how did he, you can't assume, but what does an addict feel like? What is their drive for wanting to get more of heroin?
Well, it's difficult to speculate. There are a number of reasons why people would use drugs, and a number of reasons why someone might actually end up using heroin in particular. We do know that there have been a number of people abusing prescription medications, and there's been quite a bit of attention paid to that, and so there are restrictions on that now, and it's much more difficult for people to get it, to use it illegally. As a result of that, there's been a real shift towards heroin because it's cheaper and more available. In terms of Philip Seymour Hoffman, again, it would be entire speculation to know exactly what happened. Was he experiencing pain and prescribed medication that kind of triggered and reminded him of his earlier experiences with the drug? Was he experiencing depression? Was it just exposure to other people that were using drugs? It's really unclear, but there are a number of different factors that might have accounted for why he went back to drug use after so much time. And
the euphoria that you feel, about how long does that last?
That's a good question. With heroin, I mean, the initial onset and the peak is probably within the first, I would say, I mean, it's hitting the brain almost immediately. The euphoria is probably lasting anywhere from 15 minutes to 30 minutes, and then it's going to start to decline. And that is going to last, the euphoria portion probably, it depends on a lot of metabolic factors and other things that are going on, but that could last, you know, from 45 minutes to an hour, and then 24 to 36 hours later you're going to experience the withdrawal symptoms from the heroin. And again, heroin is very quick acting, it's cleared from the body very quickly, so it's much quicker than many of the other pain medications that are available out there on the market. So again, you get into a pattern of using it much more frequently than you would some of the other opioid medications.
And Liz, how does a heroin addict feel after that euphoric state?
Well, I mean, immediately afterwards, there's sort of a desire to use again. So most heroin-addicted patients will use multiple times a day in an effort to achieve and maintain that high. If they are off of the drug for an extended period of time, somewhere, 24 to 36 hours, they'll experience withdrawal. And what I have been led to understand about withdrawal is it's very much like the worst flu you can imagine times 10. So the symptoms are shakes, nausea, body aches, vomiting, the runs, and the real issue is, of course, that with the flu, there's nothing we can do. We kind of have to suffer through it. We know that eventually we're going to get better. With a heroin-addicted patient, when they experience those symptoms, they know there's something out there that they can take, and they will immediately feel better. And heroin will do that. So if they are in withdrawal and they fire heroin into the vein, then instantaneously the withdrawal symptoms will go away, and that's very reinforcing.
Well, we're going to continue our conversation about heroin, and we will be right back. Hi, we're back again, talking about Philip Seymour Hoffman, and he is not alone in the actors and actresses that we have come to love on the screen and in person.
Yeah. Well, I mean, Corey Monteith recently, and I think perhaps for the younger generation, he may be more of a familiar figure. He also died of a heroin overdose recently. I think perhaps the reason his death wasn't sensationalized in the same way that Philip Seymour Hoffman's was is because his addiction was ongoing. He was struggling and continued to struggle with addiction, and certainly hadn't had the kind of long and stable period that Philip Seymour Hoffman had, but it's no less of a tragedy for someone that young and talented to not be able to get their addiction under control and therefore suffer the consequences of that.
So at 22, Hoffman stops using, and we don't know what it was that he was using. And then
he said pretty much everything.
Did he?
Yes. Yeah.
So we still don't know.
Right. It was a lot of stuff.
And at age 46, he begins to use again. And I'm sure there are people out there that shake their heads and say, you know, why?
Yeah.
You know, after you've been clean for so long.
And it's really difficult to know. There's certainly research that suggests that the longer someone stays clean, the greater the likelihood is that they will stay clean forever. Of course, the risk of relapse doesn't go down to 0%. So even after that period of time, it's certainly possible for someone to return to drug use. We know that he started using drugs up again in May of 2012. He started with prescription narcotics, had transitioned to snorting heroin, said it was for about a week, and then went into detox and came out, and I guess he was interviewed on TMZ about that particular episode. Everything that I've read is really unclear as to when he started again. There's some suggestion that he started 6 months prior to his death. Others are suggesting maybe 6 weeks prior to his death. But I guess the issue is that once he got back into addiction, and Paul certainly can speak to more of the brain changes that might have accounted for why, once he was re-exposed to the drugs, he was then at greater risk for redeveloping an addiction. But once he started using the prescription drugs, it wasn't a far stretch for him to move back into heroin. And of course, as we've talked before, that heroin, when it's injected, is a much more intense high.
So Paul, do you want to talk about the addiction then?
Yeah, I can talk a little bit about it. It's, again, there's a lot that we still don't know, but as the technology advances, we're discovering a lot more in the process, and we now have fairly good evidence, again, in terms of looking at gene expression changes, at looking at molecular pathway changes, the levels of the neurotransmitters in the brain, is that in some cases one exposure to a drug, but more often chronic use of drugs will change the way that your brain works, the way that your neurotransmitters are released, right, and the way that they function from their normal levels, and that those are chronic and ongoing, and they may never recover back to their normal levels. Again, the thinking is that the longer you stay away, the more likely they are to get back to normal. But we now
repair themselves.
To repair themselves theoretically, but we do know that there are changes at the gene expression level not removing genes, not adding genes, but the way they express themselves that can stay permanent for the rest of your life and can be passed on to the next generation. And so what happens is that, yes, he's overcome his initial addiction to heroin or whatever it may be, but then he's being treated for pain addiction. It's activating the same system, and it's, in some cases, we talk about tolerance adapting, so it takes, or developing, so it takes more of a drug to have the same effect, but in some cases, sensitization, the opposite happens, so that a system's permanently changed, so the next time you take even just a little bit of a compound, it has an even bigger effect than it would have alone previously.
And you had talked about environmental factors that would create an addiction problem that wouldn't necessarily be in the genes, but just my being around someone or people who use.
Right.
Yeah.
Well, you hear all the time about NAAA talks about people, places, and things as being sort of fundamental triggers for use. Certainly availability, so being in an environment where drugs are prevalent. One of the things I think that we could certainly think about or speculate about with Philip Seymour Hoffman, and it's kind of unique to heroin use, is the fact that heroin use becomes associated with a number of environmental cues, people, places, and things. And as a result of that, those triggers can actually create a physiological change that actually produces a withdrawal experience even in the absence of use. So it's very possible that even after, years, having been exposed to drug cues may in fact have created a sensation of withdrawal, even nowhere near as intense as withdrawal from the drug itself, but enough to make the person feel kind of edgy and motivated to get the drug to. And that's actually one of the reasons why people do frequently relapse to heroin use, is because 6 months, a year, 2 years down the line, they come in contact with a heroin cue and they experience this post-acute withdrawal, and they know the heroin will make it go away. So
Could be just seeing a syringe in the right setting, or walking down on a street corner that resembles where you used to purchase the drug. Anything like those environmental cues can trigger. And essentially what they do is they trigger a compensatory response so that your body thinks it's now going to be exposed to the drug. So it's preparing for the drug, and by doing that it's trying to maintain homeostasis. And so in preparing for that increase of the drug, it's changing the systems in reverse and causing that negative state. And then so you just see the syringe, you see that street corner, you feel awful, and you know how to get rid of feeling awful.
So they're the demons.
right.
It really is.
Yeah.
That's why she was talking. Liz was talking about the people, places, things. Those cues, we learn them, and they're triggers for that preparation for the drug taking, which then leads us to go experience withdrawal without the drug.